Hi, everybody. Let me turn on the captions. There we go. Welcome to GW Center for Integrative Medicine YouTube channel. I'm your co-host, Dr. Kogan, Medical Director. Wonderful weekend. I don't know if you can, I'm going to lick my computer. I don't know if you can really see this, but it's kind of chilly outside, but sunny, and we have a lot of snow. Kids and I were skiing at the Whitetail. Hopefully you got to enjoy some of the gifts of the winter this year. If you're in the Northeast US, probably can't do that. Interesting topic today. I don't know if you hear my voice. I'm trying to uplift everybody. So the topic today is depression, and the particular topic, it's a study that came out a couple of months ago, actually back in August. And the study is looking at the role of microbiome in depression. And basically, it's a very simple, very pragmatic study. I'll show it to you in a minute. But this is one of the few studies where specific probiotics showing a pretty dramatic benefit for a medical condition. In this case, it is a depression. So without further ado, what I'm going to do is I am going to share my screen as usual. And I'm going to drop right into the study. Okay. So the study titled Accessibility, Acceptability, Tolerability, and Estimates of Putative Treatment Effect of Probiotics as an Adjunct Treatment in Patients with Depression. So what did they do? So this is the study that was conducted in England. And data was collected between 2019 and 2022. They took, we'll talk about specifics of this probiotic, but they took a multi-strain probiotic. So it had 8 billion colony-forming units with multiple different strains of probiotics in there in each capsule. They looked for 8 weeks, and they basically compared placebo capsules to probiotic capsules in patients who were already on antidepressants, being blinded and being randomized to either placebo or the active treatment. So what probiotics have they used? This is the first critical aspect. So you can find here that they give us a specific description. So this is a BioCult Advanced by ADM Protexin. We do not have access to this in US, at least not that I could find directly by US distributor, but you can find this in Europe. Presumably you can maybe even able to pick it up somewhere in Europe and then bring it back home. I don't know if they can ship it because it will be quite expensive since the shipping has to be cold. This is a live probiotic, so they have to be refrigerated when you get them. But what I was able to compare, and for this I have to show you their website and then the website of the common brand I use all the time myself for my patients. So this is the product. This is exact product. You can see that they're listing every single strain right here where I highlighted. The cost of this 8 capsules per day would be about, well, let's say just estimate of about 40 euros per month or something like that. $40 per month, roughly. You can buy them in bulk and save some. And then what I would compare this to in US, and again, this is what I frequently recommend to my patients. So this is actually a lot more since one capsule is 25 billion and they used 8. So each capsule of BioCult was actually only 2 billion. Here you can see this, it's only 2 billion live bacteria versus Claire has 25 billion. And if you carefully compare strain by strain, so each of them, they look extremely similar. Now, there are some minor differences. You can pick up some, like, for example, I think Bifida infantis is not in here, and it is here. But most of the other strains are very similar. And this one also has, you can also count a very similar total number of strains, or total number of particular organisms. So now, can you truly compare them? No, of course not. Obviously, the company is going to claim this. The BioCult makers would claim that, of course, their product is unique, which you can see that each of the strain has some specific numbers here. Obviously, they're not really discussing that in the paper, but the whole point is they're going to probably making a claim that you can't compare them. Now, I probably kind of agree with that. Now, we don't know if the Claire will try to make a trial very similar to this one. Are we going to see the difference? Who knows, right? But nonetheless, let's look at the data. And by the way, there are also tons of other probiotics that are probably going to be relatively similar. Why am I talking about Claire? Well, I think it's one of the best priced products, and also it's a kind of relatively similar. It's also a product we've been using for a very long time. It's a very trusted company. Their new name is SFI Health. By the way, this is the kind of a pre-discounted price, and that's $50 for 120 capsules. So it's a $50 for 4 months supply. So it's dramatically cheaper if you compare to, because you would need to take only 1 capsule a day versus 4 capsules a day of the other product. And again, I can't fully compare them. I'm just trying to sort of see how, if you watching this video decide that the study is worthwhile for you to try probiotics, well, would you get this? So this is what I'm trying to compare it to. Okay, so let's look at the sort of what actually happened in the study. Study predominantly were females. They didn't really, basically, most women were white. Again, it's kind of a typical expectation. Unfortunately, in studies, it's difficult to recruit other. So, I mean, I'm not surprised by any of this. Mostly female, as I mentioned. You kind of have to think about what does some of the scores that they used. Well, they use multiple different scores. So the HMD-17, IDS, and CGI. So in essence, all of this scales are pretty typical. They're used for research. They're not necessarily kind of clinical scores, although some of them in a certain forms are used clinically. So nothing really unusual about how the data was assessed. So I'm going to skip a lot of things here. But in short, I think important point is that they didn't have a lot of patients. They had they had 24 in active, in placebo, and 25, I think, in active. And they were young patients. So they were as you can see, let's say around age of 30. So this is what happened. So again, this is some of the standard scales, as I mentioned. I'm just going to show you real quick. You can see that compared to placebo, there's pretty dramatic difference wherever you look. The difference reached statistical significance very quickly at 4 weeks. Almost everything, I think this was not statistical significance, but here there was statistical significance, so it was here. And what's really interesting, if you look at CGI, which is again a very common score, and CGI indicates clinical global impression improvement subscale. So sometimes they use this in the studies to say, well, okay, so everybody got better, but did everybody get a lot better or just a little bit better? Since obviously it would be important. So it broken down in very much minimally and no change. And you can see it's a pretty dramatic difference. So in the group of probiotics, you had some patients even at week 4 reporting a very much improved versus nobody in placebo group. And in week 4, most people in placebo group say no change whatsoever. And only at around age of 8 weeks, there was some much improved minimally in placebo group. But again, you can see that in probiotics, no change had a very, very small amount. Now, also, please do note that this is the case where the randomization was complete and it was high quality because, probiotics capsules generally don't have taste, can't really figure it out. Even if you open them up somehow and try to do something with them, you won't be able to easily figure out if it's placebo or not versus many other treatments. And actually, they have a way of looking at the randomization, say, did the randomization succeed? And in this case, it has. So this is quite dramatic, actually. Okay, so let's look at, in addition to that, let's look at a couple other things. If you look at the totality, I'm going to stop sharing. If you look at the totality of the data, what do I mean by that? How total response rate. So, because this is usually how, in controlled trials, the depression is assessed. So if you're looking at the typical antidepressant effect of a pill, let's say you take some very common medication, I don't know, specifically pick on any, and you look at the studies published, you would typically expect that placebo will improve somewhere between 30 to 40%, maybe even a little bit more. And the pill would give you, let's say, probably up to 10%, basically just crossing double digits more on top of that. It would be extremely unusual for a study to have a 20% benefit. It's unheard of to have 30% benefit on top of placebo. And much improved is also unheard of. You typically have a mild to moderate improvement with almost no one claiming much improvement when you look at CGI scores. Now, here you had a 54% of patients who had an actual very much improvement in the control arm, in the treatment arm, versus 32% in placebo. So you had basically 20% improvement over, which would basically be better than most of existing antidepressants. Now, of course, this is on top of antidepressants. So it's not like this patients, you were taking nothing, so no treatment at all. Now, these patients were young, right? They were mostly women. They were mostly white. So can you translate that to you? I don't know. Obviously, I don't know who's exactly watching. And also the key question is then, well, should you start to take probiotics? And here, the thing is very interesting. Here's what the way I make a conclusion out of this. I say, yes, absolutely, take probiotic. Take something like the Claire that I mentioned. By the way, I have zero financial relationship with this company. I just like to recommend this probiotics frequently. And if you have a provider who works with you, who knows the probiotics very well, of course, talk to the provider, because it's very possible that they can find you something a little bit different. If you're in Europe, I'd say definitely get this one, even though you probably can get a lot cheaper probiotic. But because this one was studied, I definitely recommend, if you have access to this, do it. I will put the link to the company, and it looks like they sell it directly on their website. So I'll put the link there. Again, I'm pretty sure if you need to ship it to US, it'll be tricky. Also, do note, we've tried to ship probiotics from Canada and Europe. The specific unique probiotics, actually, I'm talking about something called Mutaflor, which is a E. coli probiotic, beneficial E. coli. And the customs arrested it. And then they held it on a border for like 2 weeks and then released it. But by that time, the probiotic went bad because it was not refrigerated. So, you may have real problems getting into US. But of course, I still would suggest that if you have a capacity, do so, simply because that's what's been studied. Now, let's say you can't do that and you're going to go for Claire or something similar. What I would do is I would do what was done in a study, get 8 weeks supply, and then see what happens by the end of the 8 weeks. And if you're feeling better, sure, why not continue? Sort of precautions. So I would only put a precaution here if you have a chronic intestinal problem, particularly if you have a condition called SIBO or SIBO, small intestinal bacterial overgrowth. Taking probiotics in that case may actually make SIBO, SIBO worse. So you have to be a little careful. Other than that, and it's not even a contraindication, you can just take it, and if your symptoms get a lot worse, you can decide whether that's worth the mood improvement that you may or may not get. So pretty fascinating stuff, potentially very low cost intervention, potentially not just safe, but very safe. Obviously, probiotics, in particular Claire, for example, will have a whole bunch of other potential benefits. It can protect you from some other intestinal infections like C. diff colitis. You may even have other intestinal benefits, or you may not, right? So the data on all of this is quite in the mix, but nonetheless, I think it's a pretty interesting trial. I wish trial would have been larger. And of course, I have talked a little bit about the sort of obvious elephant in the room, right? So the study was sponsored by the company. I forgot the name of the maker of the that was sponsoring it. Give me 1 second. ADM Protaxin. You can find the name of the company in the link when I'll put it to the actual product, to the BioCall. So yeah, so the study was sponsored. The PIs, the principal investigators, so the researchers were actually paid consultant for the company. So, you have relationship that potentially, definitely there is a conflict of interest. But then there's a very clear statement here at the end of the study that neither researchers, that funders have actually have no, I'm just going to read this. The funders had no role in the design and conduct of the study, collection, management, analysis, and interpretation of the data, preparation, review, or approval of the manuscript, and the decision to submit the manuscript for publication. Now, of course, right? Of course, if your PI is sponsored by the trial, the company that sponsors the trial, you know, you still have clear and obvious conflict of interest. But nonetheless, I still think that if this would be a medication, we wouldn't be talking about precautions, right? We would just be simply saying, oh, good study, very strong result. This would have been everywhere, right? And this would be, everybody would be immediately asking their doctor, can I start this now? Because it's probiotic and because it's, you know, non-covered, medication treatment, we are not necessarily seeing every psychiatrist beginning to recommend this for obvious reasons. Not only for the fact that, you know, I don't think there's enough data. Actually, I think this is very high quality study and it would be easy to implement with minimal risk, but simply because most psychiatrists are simply not versed in how do you pick the probiotic if they can't get access to this exact one. What are they going to tell to their patients? So hopefully this video is somewhat helpful for you. Please subscribe if you like this. Stay tuned for more specific updates like this on all things health, integrative medicine, healthy aging, and such. Have a wonderful day. Do spend it outside, even if a little bit, catch the sun. And we'll see you here soon. Take care. Have a good one.